Assalamu alaikum. Dr. Bushra here. Today our topic is venous drainage of heart. Venous drainage of heart occurs through two main pathways. The main drainage is through the coronary sinus that drains about 60 to 70% of venous blood from the myocardium into the right atrium. Rest of the drainage that occurs into the right atrium through anterior cardiac veins and the small cardiac veins called the Trapezian veins. These veins, they do not open into the coronary sinus, rather they open directly into the right atrium, while coronary sinus, having its tributaries, it drains into the right atrium itself. So here you can see the coronary sinus. This is the coronary sinus location. It is located posteriorly in the posterior part of coronary sulcus or the atrioventricular sulcus. That is the sulcus that separates the atria from the ventricles posteriorly. Then it extends, the coronary sinus extends from left to right, and it opens into the right atrium between the inferior vena cava opening. This is the inferior vena cava opening and the tricuspid valve. It opens between these two openings, and it is the main venous channel of the heart. Here you can see this is the right atrium. This is the opening of superior vena cava into the right atrium, and this is the opening of inferior vena cava into the right atrium. This is the fossa ovalis, and this is the tricuspid valve. And here is the opening of coronary sinus into right atrium between inferior vena cava opening and the tricuspid valve. Now, what are the major tributaries of coronary sinus? Many important veins, they open into coronary sinus, which includes great cardiac vein, middle cardiac vein, small cardiac vein, left marginal vein, left posterior ventricular vein, and oblique vein of left atrium, that is a vein of Marshall. So, first we'll discuss about the great cardiac vein. Great cardiac vein, it begins near the apex of the heart. It runs in the anterior interventricular sulcus, and it is accompanied by the anterior interventricular artery, that is the LAD, left anterior descending artery. Then it turns left into the coronary sulcus and continues into the coronary sinus on the posterior aspect of the heart. Now, the areas which are drained by the great cardiac vein, these are the left atrium, left ventricle, interventricular septum, and the blood flows in the same direction as the paired coronary arteries, which is an unusual arrangement. Then comes the middle cardiac vein. Middle cardiac vein, you will find it posteriorly, and it again begins at the apex of the heart. It runs in the posterior interventricular sulcus along with the posterior interventricular artery, that is commonly a branch of right coronary artery, and this is the artery which is responsible for the dominance of heart. If this posterior interventricular artery, it comes from the right coronary artery, it is called right dominance of heart, and if it comes from the left coronary artery, it's called the left dominance of heart, and if it comes from both the arteries, it is called codominance of heart. So posterior interventricular artery runs in the posterior interventricular sulcus posteriorly, and it is accompanied by the middle cardiac vein. Now the middle cardiac vein then enters into the coronary sinus, and this middle cardiac vein, it drains the posterior, as it is present posteriorly, so it drains the posterior aspect of the ventricles and the posterior part of interventricular septum. Then the small cardiac vein, this is the small cardiac vein. It travels along the right margin of the heart, and it accompanies the right marginal artery. So from the examination point of view, you must know that which vein accompanies which artery. Great cardiac vein, it accompanies the LAD, while the middle cardiac vein, it accompanies the posterior interventricular artery, and the small cardiac vein, it accompanies the right marginal artery. And area of drainage of small cardiac vein is the right atrium, and right ventricle. Then comes the left marginal vein. Here you can see the left marginal vein. It accompanies the left marginal artery and it drains the left ventricle. Then the posterior ventricular vein. This is the left posterior ventricular vein. It drains the posterior wall of left ventricle, and left marginal vein and left posterior ventricular vein, they open into the coronary sinus again. Then last one is the oblique vein of left atrium. Here you can see the oblique vein of left atrium or vein of Marshall. It descends over the posterior part of the left atrium and it joins the cardiac vein to form the coronary sinus. So if someone asks you about the formation of the coronary sinus, you must say that it is formed by the union of great cardiac vein and the oblique vein of left atrium or vein of Marshall. Here you can again see the anterior interventricular sulcus in which the lead runs along with the great cardiac vein. This is the posterior aspect of the heart where posterior interventricular sulcus is seen, in which the posterior interventricular artery along with the middle cardiac vein runs. This is the posterior left vein draining into the coronary sinus, and this is the oblique vein. Here you can see the small cardiac vein. Then there are some veins which do not drain into the coronary sinus, rather they drain into the right atrium directly. And these veins, these are not the tributaries of coronary sinus. And one of them is the anterior cardiac veins. Anterior cardiac veins, you can see here, they cross the coronary sulcus here. Okay, they drain the anterior surface of right ventricle and they open directly into the right atrium. And sometimes they join the small cardiac vein. This is the small cardiac vein. Then the smallest cardiac veins, that are the Thapasian veins, these are the minute veins within the myocardium. Then they open directly into all chambers of heart. They are most numerous in atria and right ventricle, and they are the valveless small veins. Here again, you can clearly see the anterior cardiac veins crossing the coronary sulcus, opening directly into the right atrium. So if I ask you about the venous drainage of heart, if you can answer this in the comment section, you can. That if a 58-year-old man develops a rare thrombus within the coronary sinus following cardiac surgery, venous drainage from the myocardium supplied by the left coronary artery is expected to be most affected. Which vein contributes most to this drainage? So option A is small cardiac vein, B is middle cardiac, C is great cardiac, and D is anterior cardiac vein. Second MCQ is a 70-year-old man develops a thrombus that completely occludes the coronary sinus. Venous return from most of the myocardium is impaired. However, venous blood from the anterior wall of right ventricle continues to drain directly into the right atrium. Which veins are responsible for this drainage? Options are great cardiac vein, middle cardiac vein, small cardiac vein, and anterior cardiac vein. Then third one and the last one is that a 62-year-old man presents with an acute inferior wall MI due to occlusion of posterior interventricular artery, that is the posterior descending artery. During coronary angiography, the cardiologist identifies the vein that accompanies this artery in the posterior interventricular sulcus. Which vein is most likely accompanying the occluded artery? Option A is great cardiac vein, B is small cardiac vein, C is middle cardiac vein, and D is anterior cardiac vein. So this was all about our venous drainage of heart. Thank you so much.